the place I would like to start is why Eastern medicine? And I say that because I think there is a bit of a shift now into people trying to look to marry them both. But I know for a while it felt like it was this way, or you try Western medicine, then move to Eastern medicine. So obviously, as someone who's
Yeah,
made a
yeah,
career in it, 23 years, I think, can you
yeah.
tell us how it
Wow, you
started?
did do research on me. Um,
Thanks.
so yeah, I think that sensation that concept that like there was this kind of divide
Mm,
wasn't coming from Eastern medicine. And it was partially how it was, and I know you're in New Zealand, but we'll call that the West too.
yes.
Um, Within that, the the idea when Chinese medicine kind of first got outside of Asia, let's say,
Mm,
there was this kind of thing that it was mystical, that it was this like weird spirituality, and yeah, there's some truth to that in the history of East Asian medicine, because a lot of the people that were practicing it early on were the Taoists and the Buddhists, right? So
mm,
there are mentionings going back throughout history with that, but it was always practiced as a medical system. So sometimes they had concepts when we don't have terms for mental health, right?
mhm.
We start giving it like these like, oh, that must be a demon, or that must be a ghost, or that must be something like that, and it's like, no, they're schizophrenic. Yeah, and because of that, and because of this idea of, or this concept which Westerners ran with, and they're like, oh, it's energy, it's mystical, right? This concept of chi, right?
Mm,
And even that was really just to describe the body's ability to perform functions when it needed to. And if we
mm,
look at chi and we translate it directly to energy, we if we look at it more like physics, like, does it have the ability to do what it needs to do? Like, does it have that kinetic energy to actually be doing it, or the potential energy? It'll do it when it needs to. That describes really what's going on when we're talking about diagnosis and treatment with acupuncture. We want to restore function, right?
mm,
So it was never practiced as this kind of alternative thing in Asia, and it was done alongside. There's several different terms for doctor depending on what country you're talking about, but they did surgery. They were giving herbs because they didn't have modern day pharmaceuticals, but they did do concentrations of herbs, which are essentially how we got into Western pharmaceuticals. So that was something that the West was like, oh, we watch kung fu movies and we'd see somebody like shoot energy out of their hand and stun somebody, and it kind of I think it was detrimental to East Asian medicine as a whole. I think people now are looking at it more because we know that it's not always drugs and surgery that are going to save us, and really, if we want a healthy lifestyle, it's not just going to the doctor, getting your checkup, and you're on your way. It's what are those meals that I'm eating in between? How am I moving my body on the regular basis? How am I resting? And East Asian medicine has always been a big whole body picture. Like, and when we say whole body, I mean spirit and
mm.
emotions and stuff there too, and it was all about balance. So I think today people are really leaning that way because they're looking for that, right? Especially after like global pandemics and everything. Wow, no one can save us. What do we got to do to keep ourselves up and functioning, right?
Yeah.
And how I got here was really I don't know what the medical system is, or the let's say the administering system is in where you're from, but here the medical system, right? Oh, we're still the best in the world. No, if you can afford it, if you can get access to it.
Mm.
And Chinese medicine is all about taking care of people's lives, right? So we say, and I say this, God, almost every goddamn day now, acupuncture is the expression of humanity. So it's not just looking at hey, how you doing today, Kim? It's, well, what's not, oh, I came in for my knee is feeling better, now we're done. It can be, well, what else is going on in your life? Are you sleeping okay? How is your work life balance? And you really get to be part of other people's lives with this, and that's really what drew me to it.
Um, I interestingly was diagnosed with depression and anxiety from a psychologist.
Yeah.
About 6 months prior to that, I had broken my wrist, and both a chiropractor that I went to and my first time going to an acupuncturist kept asking me about my mental health. And
Mhm,
whilst didn't necessarily diagnose me with depression, alluded to me having depression from looking at, in the acupuncture site, looking at my tongue, asking
mhm,
about
mhm.
period blood color, if I might be so transparent with you, and a few other things. And it wasn't until I kind of got what I would consider more of like a medical diagnosis, and I was running away from it as well. Um, it was one of those aha moments I've had in the last sort of year where I was like, actually, there was some telltale signs earlier. I'm
Mhm.
curious when it pertains to depression, what are some of these symptoms that you guys are looking? And
Dude,
I'm just
so
curious because is it, if it was a vibe, I don't this woman isn't practicing anymore in this area, but yeah, I just thought it was so interesting. I was like, so they knew before I knew, or my family knew, that
yeah,
something wasn't right. And I'm just curious if there are a few telltale signs that maybe we
it,
project that we're
there
unaware of because you're dealing with it more.
it is ooh, yes, there are.
Hmm.
And it can be different as acupuncture evolved over these thousands of years. Different people, different practitioners kind of train and focus in on different things. You mentioned the tongue, right? So if you stick out your tongue, we don't have to do it right now. But the shape, the body of the tongue, the coat on the tongue, and specifically when we're talking about the heart, right? So it's funny you broke the wrist because the heart and the pericardium channels are right there, and the lung channel is right there. So it doesn't have to be right on there, but we'd say so. The lung, the emotion associated with the lung channel in Chinese medicine is grief and loss, right? So we can have some depression because maybe we lost somebody we love, and it doesn't have to be a death, it could be the end of a relationship. Heart and pericardium are joy or lack of joy, right? So, you might have stuck out your tongue and the tip of the tongue was red, or like it didn't have a nice round curve. It could have been flat, right? All of those little things might mean something. Or then we take your pulse, and in Chinese medicine, we're actually looking at 12 different pulses across the two radial arteries on the wrist. So each one of them, like we have, like I describe it like frets on a guitar. So we're
Hmm.
putting a finger in three different positions, but then we're not putting much pressure, and we get the six yang pulses, the uppermost pulses, and then we get the six deeper, and we describe them with some weird adjectives that don't translate too well into Chinese to English, and then they're highly
Hmm.
debatable. But we also look at the strength of each of those positions, and sometimes those will point us in those areas, right? And even when we're talking about psycho emotional disorders, right? We're not saying that like everybody with depression has a heart imbalance. Oh, what could it be? Oh, it could also be like the liver, and the liver's about frustration. And sometimes that frustration is turned inwards. Why am I like this? What's wrong with me? Right? We get angry at ourselves.
Hmm.
And we'll tease out that. Sometimes it's even some practitioner will key in on the words you use. So you
Hmm.
start describing yourself differently. Well, that's a weird way to say that, you know? And it even gets out there with over these thousands of years of signs and symptoms. Some people key in on the smell of the patient, right? Not necessarily an unpleasant aroma, but you walk into somebody's house, and it smells different than your house, right? Color under the eye. So many women have eye makeup on, but and I'm also colorblind, so that one I lose. uh but within that, these different shades, oh, maybe there's a little green, maybe there's a little black, maybe there's a little white, and it's a subtle hue, right? Because everybody's under their eyes going to be a little bit darker, but those subtle hues kind of go and we're not going to hang a complete diagnosis on that. But like when you have so many checks in a certain box, that's when we want to look there.
Hmm.
And then we go to those channels and give them support, or we give herbs as an intervention to kind of tonify and build up those channels to help.
Hmm. Um, and thank you for answering that. I guess it was one of those things where I thought that I was acting very well as an actor by trade, just being
Mhm,
like,
mhm.
everything is fine. No one ask any further questions. Like,
That's was a meme. I'm an accountant, right? That's it. Boom. No one's gonna ask you any more
yeah, yeah,
questions
good.
after that.
That's
It's
all. Yeah,
boring.
yeah.
Get them out of here.
Thank you for your time.
Yeah, but yeah, I totally get that. But even that guarding.
Yeah.
That's a sign, right?
Mm,
Yeah, some practitioners might blow through that and then have you crying right there on the table, but that's not
sure.
what we need to do. If we're aware of it, oh, okay, I can stop there. We know
Mm.
there's something there.
So maybe break this down for me, and this is my
Sure, sure.
ignorance. How I don't even know if this is a possible question, but I'll try it.
Do it.
How does acupuncture help or support people with mental health? I don't want to say issues, or maybe who are living with anxiety or living with
Yes.
depression. Why would someone choose acupuncture as a form to maybe work in partnership with talk therapy
Hmm.
or something different? Because I think New Zealand, bless its sweetheart, we are a little bit and I'm speaking generally, a little bit
Uh-huh.
less evolved in other ways to medicate mental health other than cognitive behavioral therapy. There's not a lot of that
Hmm.
is still kind of like yeah, we just haven't progressed. So that's why I want to have this
I
podcast
gotcha.
and have these conversations.
Yeah.
So maybe if talk therapy is not for you or you want something else, how can acupuncture be a
Yeah.
tool?
So, first of all, let me say, about a third of my practice, there is a mental health component to it.
Okay,
If that's their direct diagnosis, or they're adding that in with, they're there for fertility support or something like that.
great.
When and I'm going to give you a little bit of Eastern and Western here. Yes, talk therapy I think is necessary for most people.
Mhm.
But you did say something that's pretty keen, which is like not everybody wants to sit there and open up that
Mm,
that chest of emotions there and dig into every open wound. And a non-talk based therapy can really benefit some people.
mm,
Now, our classical textbooks say things like the root of all disease is first in the spirit, right? So even before we have that back pain,
mm,
oh God, there was an emotion, a psychological component. We can get super esoteric and say something spiritual. What's the lesson you need to learn? Like, oh, it's karmic. Yeah,
mm,
we can break it down in the even Western, right? This is a neurotransmitter issue, right? I'm not producing the right levels of serotonin, dopamine. I
mm.
can't find that balance, that thing that gives me that the joie de vivre. I'll mispronounce French nicely. Um,
It was great. I don't
uh,
know. So I'm like, that sounds right. Yeah.
the joy of life, let's
Yeah.
say. But when we treat with acupuncture, we see, and this is even that concept of chi,
Mhm,
that developed because so many things happen inside your body when you're getting acupuncture. And while we don't know exactly why, we can measure that now with Western science, right?
mhm,
And I say this a lot. Our profession, the studies that were done to disprove us. Then they were going, oh my God, these guys are telling the truth. Why? Right. So there's this overarching effect that happens when you get acupuncture, and it comes down to your autonomic nervous system, right? Autonomic nervous system is fight or flight, rest and digest. The modern
Guess
world,
where I sit.
everyone's in fight or flight, right? Almost everyone. There's some exceptions. Those are a weird category, but like 85% of the world's population, fight or flight.
Mm,
Why? Because even though our lives are infinitely better than they were when we first climbed out of the trees and started being humans, easier, I should say, we're still have this hyper developed sense of everything's going to kill me,
mm,
right? So we're constantly in this fight or flight, and we have physical symptoms because of that, but we also have psycho emotional symptoms because our body isn't running properly. In
mm,
Chinese medicine, right, we have this concept of like the ghost in the machine, right? That's a Western idea. Like there's a spirit somewhere
mhm,
sitting in the body. Chinese medicine, it's like, no, this is all energy. It just gets denser and denser till it takes form. So
mm,
those psychological, those spiritual issues that we have, they're embedded in our body. They're part of our body. Our body's part of our psycho-spiritual system, and you
mm,
can't tease them apart. Why? Because it's all the same, right? We have different parts there, and one of them returns to the earth when we die, and the other goes off wherever you believe it goes.
mm,
Um, But when we treat with acupuncture, we put those needles in. After about 10 or 15 minutes, we switch you out of that fight or flight mode. We put you into that rest and digest mode. Now,
Mhm.
physically, we get better blood flow. We pick up more oxygen in our lungs. We off gas CO2 better. We get more blood flow to the intestines. So we're picking up more of the nutrition
Mm,
that of all the food we've eaten. We're eliminating a little bit better. But some really other interesting things happen. Our glands work better. So that's all our hormones across our body, right? We're
mm,
telling our body that we're calm and we're safe. So our adrenal glands go, okay, cool. I can pump the brakes on kicking out the cortisol.
mhm,
Our serotonin, our dopamine, those are a weird, nerdy neurobiology joke is technically those are the only two things you like, right?
mhm,
Those are our like joy type compounds. Um, those start to normalize. We start kicking out oxytocin, which is a like a partnering, a bonding type compound. So we have better interactions with other people. And
mm.
in the 90s, we discovered this whole system, endocannabinoid system, right? So our brain has receptors on it that light up when we smoke pot. That's how we get high. You guys call it pot over there? You probably have
Yeah,
all the same names.
yeah,
Okay.
yeah,
Uh,
yeah.
but in the 90s, we discovered that these receptors are all over the central nervous system, and we
Mm,
have some on our immune system, right? So when we're blue, we don't, our immune system gets depressed.
yeah.
When we get acupuncture, we start making these endocannabinoids, these endogenous, these inside our body compounds that look like marijuana. And they bond to those, and we get that kind of goofy, kind of happy, kind of floaty feeling. Now, I love that compound because it's called anandamide. Ananda is Sanskrit for bliss, so they call this the bliss molecule,
I love
right? So when we show our body that, like, hey, the serotonin and dopamine are normal, when we show that the endocannabinoids are flowing and oh, we're kind of blissed out, we
Mhm.
remember that, right? So we're not taking you away from the trauma. We're not solving that for you. We're showing you like, hey, it's okay right here. We're all right now.
Mhm.
And that starts to build. And that's kind of what CBD does. CBT does. I'm
Mm.
mentioning other endocannabinoids.
Yeah, yeah, yeah,
Uh,
yeah.
but within that, right, we're okay. I'm okay right now. Why? Let me look at this critically. Let me look at this from an outside standpoint. I'm okay. This is happening outside of me,
Yeah.
right? So we're showing our physical body that, and we have that psycho emotional release. Now, I know a few practitioners, and I actually had one teacher that was a psychotherapist first. And what she was doing was she was referring to acupuncture
Mm.
when some of these patients plateaued or they had these blocks or this was really traumatic and they've really locked it up, and not necessarily have them access that trauma but be able to process it in a
Yeah.
nonverbal way. So these two go hand in hand so well. And it's so much fun to treat, actually, to see somebody not have something substantial. It's not like their arms hanging off,
Yeah, right.
but you know they're suffering and you're able to still help them.
That's so cool. Um, I guess the natural segue is how does cupping come into this? Because I know
Ha!
you've got a cupping book coming
Yeah,
out.
yeah, yeah. I'm
The
supposed to be
cupping book,
promoting that, right? But
apparently.
that's not even like we want to talk about other things. But so cupping
But I,
therapy.
I am curious because I've only had cupping on the wrist as well, in like
Wow,
mini little, which I'm
teeny tiny
assuming is
cups.
still mini tiny cups. Yeah.
Yeah, yeah, they are, and honestly, that's part of the reason I wrote the book is because we have all these tools now. Traditionally, you needed to use fire to get the vacuum, to create the suction of the cup.
Right.
Um, that's what was done in households all over the world for thousands of years. And then somebody who said, all right, you're going to write a book on cupping, you're going to do fire cupping. What about the liability if somebody burns their house down? And I'm like, okay, we won't talk about fire cupping, right? But we have these tools now that are all they're silicone or they have a pump or but cupping was kind of adopted into Chinese medicine, right? So it had been discovered, practiced. I don't even know where to call it or what to call it.
And
Somewhere.
let me tell you that my only knowledge about
Yeah.
cupping is people in the Olympics have circles on their back.
Yeah, yeah.
And I just watched the Simone Biles doco. They've got a bunch of circles on their back.
Yeah, yeah.
Had many cupping on an injury. So I have no knowledge or
I
understanding
mean, you've
other.
gotten the very public view right there. I mean, that's
Yes.
that's it. The day after Michael Phelps, the American swimmer, who like in 2016, I'm in Baltimore, Maryland.
Mm,
So all our local news stations all went nuts because that was the hometown hero, right?
that's
So I get a phone call from one of our local news stations. Hey, you're in the area he lives in, and I go, no, he moved, you know, halfway across the country when he was training for this Olympics.
yeah,
But yeah, I'm there, and then can we come in and film you? Yes, of course. You know, who's
that's
gonna not gonna
cool.
take free publicity? But within that, you know, it what was exciting for me was like 4 years before that, he's getting interviewed because he's still racking up gold medals back then. But the Asian swimmers were all walking around with cupping marks. And you know, like all of those athletes are interacting, they're
Of
seeing
course.
somebody else get something done, they're seeing them perform better, and they're like, what is that? And when you're at that level,
Yeah,
the littlest bit's gonna, possibly get you a medal or not.
totally.
So they all do it. But within that, that's one of the biggest uses is musculoskeletal pain, workout recovery. And part of the reason is that suction on the surface of the skin really increases blood flow to the tissue beneath it, right? So what happens is you create this vacuum either by pump or by fire, and the skin gets pulled up into that cup. So the skin's getting separated from that fascia, that connective tissue in the middle. That connective tissue is getting pulled up, creating an even bigger space. And then because it's a closed system, the blood that's deeper in the tissue in the muscle or even in some of the organs, we have studies that show this affects 6 inches into the body, gets more circulation. So at the surface, you're breaking all these capillaries, which gives you that perfectly circular hickey.
Hmm.
Um, but that void in the tissue in between
Mm,
is really where all that old blood, the blood that has lactic acid or
mm,
inflammatory markers or metabolic waste gets pulled up into. And then your lymph and everything else kind of drains that and fixes that over a few days. But you've created this space and you've pulled fresh blood into that tissue with all those healing compounds, the oxygen, the nutrients that you might need to repair and loosen that tissue up. And that's where the healing happens.
mm. Okay, that makes sense. Yeah.
I mean,
I
it's
didn't even, I mean,
mechanical,
it's,
but it's
yeah,
very like direct. Like what do we do? We literally pull blood into that tissue.
yeah. Okay. And so, yeah, I guess if you were competing every day, you would need to keep
Yeah,
it.
and that's part of the reason those swimmers and those athletes are so dark. The marks themselves
Mm,
because the blood's already pumping. They're probably getting right on the table after the event, and a trainer, somebody is doing that cupping to them. and
mm,
and because the blood is pumping so much, you get this really nice dark purplish reddish bruise.
that's great. I did have to laugh and just going back a step when you were saying that after a certain amount of time, you move patients from being fight or flight into rest or digest. I did have a funny moment that I was like, I bet some of the audience who hasn't tried it might think I'm not sure how much resting and digesting I'm doing with a bunch of needles and
Hmm,
being
hmm.
a stranger with a stranger in the space. But um, can you speak to people's fear around the needles? Because I
Yeah,
think
yeah.
that's
So
probably a big barrier of entry, right?
it is and even today, I mean, I've been doing this for 23 years. It was much rougher years ago. First of all, the design of the needle is very different, right? So a syringe is designed to either take something out or put something in. So first of all, it's a larger size.
Yeah.
Second of all, it's designed to actually rupture tissue to create a space, right? So if you look at the edge of it, it looks like the edge of a knife,
Mm.
and it goes in and it cuts. And we can talk about technique too, because there's some technique issues.
I'm
You
sure.
can mediate how bad the needle hurts, even a syringe. Um, but acupuncture needles aren't designed to disrupt tissue.
Mm.
So when they're designed, we can make them, and now with modern tools, they're thinner than they've ever been. And
Mm.
especially Japanese systems, they like to lean on thinner and thinner needles. In most cases, we want to pride ourselves on being painless, right? So you hopefully you have a sensation, but it's a pleasant.
Mm.
The tips of those needles, they're solid. They're not taking anything out. They're not putting anything in, and they're more rounded. Sometimes they call them like a pine cone tip. So it's not super sharp. It's not super blunt, but it's meant to kind of pass in between the cells.
Mm,
And some of that effect, some of the trigger that happens in your body, they call it an artificial splinter. Hey, there's something in my arm that shouldn't be there. So what am I going to do? I'm going to send fresh blood there. I'm going to trigger this cascade effect down to that needle,
yeah.
and that gets blood flowing everywhere. But they should, even larger needles, even stronger stimulation. It shouldn't be true pain. In most cases, the patient will start, especially nervous ones, going like, "Oh my god, I don't think I'm going to be able to do this." And you put a few in, you make sure they're comfortable, and then after a few minutes, they're surprised.
Yeah.
Often you'll walk in and they'll be snoring, and you go, "Hey, how you doing?" They'll go, "Oh, I must have fallen asleep there." It's like,
Bye.
"Oh,
Yeah.
I almost fell asleep." No, you were out. You were you were out. No, you were gone. Yeah, and because this is a therapy, it's not something you do once.
Yeah.
The more you do it, the more you know what to expect, the more comfortable you are, the quicker you drop into it. And
Mm,
even now, I've had patients that have been with me for years and years and years, and they're coming in for maintenance.
yeah.
We have those charts on the wall where it's like, oh, it goes here, it goes there, it goes there. Those are the ones, and this is how I think acupuncture really developed into like a formalized system where you put a needle in their foot and they're like, wow, I feel this little sensation right here. And it's like, oh, good, because the chart goes there. But it takes a while for them to be even sensitive to
Um,
those sensations. So
yeah.
once you get over that fear of the needles, you unlock this kind of like, wow, I feel this kind of fluttering, or I feel this
Mm,
movement, or I feel this warmth kind of going up and down this area.
mm,
And that's kind of like people like that, so it's not just being painless. It's about having these kind of cool sensations that are not,
mm.
yeah, it's not like you're getting too close to a stove. It's not like, oh,
Yeah.
electrical. It's something else. And normally they'll say, I feel something. I don't know how to describe it. And you're like, oh, that's the chi, right? Then we then we pull that term back.
You got it. Yeah, yeah,
you
yeah, yeah.
know?
Would you mind speaking about the mind body connection?
Yeah.
And I say this because I understand it conceptually. I
Hmm.
understand all of it. And maybe you can speak, you don't need to get too personal if you don't want to, but I think the more I'm learning about it, the more panicked I'm getting because I do feel like I'm at the beginning of my journey of understanding my negative self-talk and how
Uh-huh.
that has perhaps it ruminates in physical ailments mainly around the gut and stomach and stuff for me. So I think what I'm learning early in this journey is like I've got to try and help the mind to help the body because they're connected,
Yeah,
obviously,
yeah.
which I'm learning. And with that has the side effect of also being a type A perfectionist with um, trying to monitor those thoughts so it prevents the thing. Like I almost feel a sense of exhaustion. In my
Hmm.
journey, I'm at like an exhausted phase where I'm like so worried about my thoughts affecting my physical symptoms that it's becoming, yeah, I'm
Well,
rambling.
you're almost manifesting it. Yeah.
That I'm
Yeah.
almost and the creator of it too, and then that then I worry about that. So I just wondered, like, I'm sure I'm not the only person who is sat in front of you who
Yeah.
deals with this, and it doesn't necessarily have to be from an acupuncture perspective, but as someone who is so well versed in maybe some more of this Eastern medicine,
Yeah.
is there any advice you can give me and give our viewers? Because I know there's a lot of us who sit in this realm
Yeah.
of
I
walking this journey new.
Everybody does. And it goes
Yeah.
both ways, right? We start to identify with the physical disease and then we internalize it. So it does go the other way as well.
Right. Yeah.
With that, yeah, I'm gonna keep it in the East Asian medicine realm,
Yeah.
right? When we're looking at a problem and we see a predominant emotion attached to it, or like a psychological process, right? We try and put it into one of those 12 channels. Each one of those 12 channels has an emotion, and a psychological component. We tease all that out, right? So we'll say like, oh, if you're overthinking and you're worrying, that's the spleen and stomach. If you have this real negative, angry at yourself, self-talk, oh, that's the liver, right? And it's not necessarily that there's something wrong with that physical organ. There can be, but that's less likely. Normally it shows up along those pathways on the body. And it could be anything from like a weird little blemish there to, hey, every time I get angry, this happens. Like my shoulders go up, or every time I get sad, my chest falls, or something like that. Or
Mm,
you'll start to notice those little things. Um, Breaking this cycle is what we're attempting to do with acupuncture, right? Like, let's nourish this, so when that happens. Now, I will give you a tip, and then, like, if you're looking for more guests, I've got somebody that I absolutely love.
very cool,
There's
great.
something called the emotional freedom technique, right? Tapping, right?
Yes, I've
So
heard of this.
it,
Okay.
it is loosely based on acupuncture, and the thing I like about it is they're using multiple fingers, so you don't have to be directly on the acupuncture point. But alongside of it, you're trying to reprogram yourself. You have almost a mantra. They call it something else to kind of avoid the Hinduism or the connection to that. But either way, you're talking to yourself. You're trying to reprogram it, and you're doing it physically while you're saying this thing to yourself, right? So we can unprogram that thing, because you're programming it when you're going, oh my God, what's wrong with me? Why
Mm,
can't I let this go? Why can't I put this down?
mm,
Um, so so God, there was an expression that I used to hear all the time: move a muscle, change a thought. uh but do something physical to change that. And that could be even as simple as like not moving at all and doing meditation. That could be qigong, which is like breath work and
mm,
slight movements to kind of help let go of that, right? We call that, like, we would call that energy. We actually call that, the word they use is xie in Chinese. It's evil, we sometimes translate it to, but not this exorcist kind of
mhm,
situation. Just a, hey, this is doing something it shouldn't be doing, and it's messing up my head as well as my physical health.
mm.
um so trying to break that cycle with either movement or mindfulness practices, or the combination of the two, which is something emotional freedom technique, EFT, actually does.
Okay, I'll look into that a bit. I had looked into tapping. I was curious if like I've been doing some research into like old school methods around lobotomies and
Oh,
cold plunge
you're way too, no. Don't
therapy.
go down
Not
that.
that that's it, but I was part of me wondered, I was like, well, I understand the administration of this was not a good idea, but was there some science in why they were doing this or why they were
Absolutely.
doing kind of like cold plunge techniques? Because I'm like, it's eerily similar to like more fads now. It's like maybe, although not administered in the right way, maybe there was some reasoning
Yeah.
behind
Yeah,
some of
so
that.
lobotomies, they were literally removing certain parts of the brain, normally in the frontal lobe.
Yeah.
And it was that's kind of like our rationale, like our thought processing part. So like, if you can't think about it, you're not going to have a problem with it. But that normally left those patients very, like, there was nothing to them. They were very dull. There was like no emotion, right?
Right.
And in a way that, like, maybe some people are taking antidepressants and it's at such a high level, right? They
Mm,
normally they'll describe, yeah, I'm not depressed anymore, but I don't have any joy, right? They're why I'm keeping you right here, right?
yeah.
We're supposed to fluctuate with those emotions. Something good happens, you're supposed to feel joy. Something bad happens, you're supposed to feel like shit. Yeah.
Mm.
Oh, I'm sorry. I didn't know if I curse on this or not.
Oh yeah,
It
it's
just tends
fine.
to come out. I'll
It's
I'll try
New
to keep it to
Zealand,
a
we're
minimum
fine.
either
You
way.
can speak, you can say whatever you want. Yeah.
um, but
Yeah.
when we're doing things like cold plunge, this is still playing with that autonomic nervous system when we're talking about the psycho emotional. There's
Mm,
that rush. Our body literally thinks we're going to die. That is a fight or flight situation,
mhm.
right? But we're trying to master it. We're leaning into it in this case, right? We have a cold plunge at our office. I'm pretty well versed in that.
Oh, wow, cool.
So that sympathetic, that big, oh my God, I'm dying, is coming up, and we
Mm,
sit there with it. No, I'm doing this intentionally. I'm kind of like fortifying myself. I'm strengthening myself. But when we get out, we realize, oh, I didn't die.
mhm,
Okay, I can let go. Now, if you're like chronically adrenally fatigued, if you're like burnt out, that's
mhm.
probably not the time to start like a cold therapy practice, right?
Right.
Do things that are more restorative first, and then hopefully you can get to that later.
Mm.
Don't stick anything up your nose and take a piece of your brain either.
No.
But understand that this mind body connection is very powerful, and things like creative visualization,
Mm,
tapping, mantra practice, gratitude practice, all start to reprogram your brain, which will then have a real positive effect on your body as well.
That's
So I'm not going to tease them apart, right? If you
yeah.
feel better, you're going to look better, yeah, and vice versa.
Yeah. No, that's so good. I don't know where time has gone. Just two more quick questions. Sorry
Sure,
if
sure.
I've gone
No
slightly
worries.
over.
No worries.
uh, a question I ask all my guests, and I'm curious of what yours might look like. What does your brain look like? Some people might say it's a haunted house, a garden, a
It
hamster
is
wheel.
it is a circus.
Oh, great. Good.
I've been asked, so most acupuncturists, they're pretty calm, reserved. I meditate daily. I've probably meditated more than the common reserved guys, and that's just really to keep it together. I am self-diagnosed ADHD, but given my family history and seeing what my kids do, we're pretty sure I am too.
Yeah, sure.
But it's all following passions, and a lot of those roads lead back to healthcare. So there's constantly like, not to get too personal, but I was sitting in a therapy session, and the therapist said something, and I was like, oh, I wonder if. And I started going into like the cranial nerves, specifically the vagus nerve, which regulates autonomic nervous system, this fight,
Yeah.
flight, rest, and digest that we've been talking about. And I'm like, oh God, there's this category of acupuncture points, and I'm wondering if this hits all of those. And the therapist was like, are you here? And it's like, oh, I'm writing an article. I'm sorry.
Yeah, 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 yeah. Thank you
Like,
for your
I'm
time.
already
Yeah.
trying to get published right now. So
That's
but
so
it's a
good.
good place because
Yeah.
in East Asian medicine, we want that creativity. We want to be able to
Yeah.
look at that person on the table as freshly as we can, and the more
Mm,
we assimilate into that knowledge base, and if we're talking about 5,000 years traveling worldwide, mostly in Asia, none of us are going to hold even a fraction of that, even the most enlightened master of East Asian medicine. So we
mm,
kind of keep having to add to our own toolbox and our own understanding, and hopefully we can have better impact on patients. So you have to internalize it, you have to become that.
mm.
And unfortunately, I think that's driven me even a little bit more into the craziness in the brain. There's 1,000 open tabs, let's say.
I love it. I very much relate to that. It's but you have passion and energy, which is so cool. It's
Oh, I'm gonna pass out once we hang up.
yeah, yeah, great, great.
I'm gonna fall right over.
Thank you so much for your time. Now, if people want to find you, follow
Yeah.
you, get your books, where is the place that they should go?
So I'm gonna send you right to my clinic's webpage,
Cool.
Charm City Integrative. Charm City is one of the nicknames for Baltimore.
Mhm.
Integrative is kind of what we do. We try and really assimilate different practices, both modern and ancient, together to best help people.
Mm, that's
So
so good.
charmcityintegrative.com is you'll find everything about my book, me, book me for lectures, all that stuff.
That's so good. Hey, Dr. Tom, thank you so much. It's been such a pleasure.
Oh, Kim, no problem. Thank you so much for having me.